no testing. I can no hear the channel. So if you went to the carrot,
this is what Dr. Isioma Okobah Foundation is presenting to the world and to you. We want to congratulate you, and what you have here is First Delta America Hospital and Dr. Isioma Okobah Foundation in collaboration with the Delta State Primary Care Development Agency is presenting to you a 2-day medical outreach.
May 29th and 30th, 2024 will remain remarkable in the lives of these elderly people, the needy and the less privileged in Igbodo, in Ika North East local government area and its environs, as the special days that the angels in human form visited through Dr. Isioma Okobah Foundation in collaboration with First Delta American Hospital, Asaba, and the Delta State Primary Healthcare Development Agency on a free medical mission, which was part of our commitment to providing accessible, quality, and affordable healthcare to communities. The 2-day medical mission offered free medical consultations, checkups, and treatment for conditions such as hypertension, diabetes, hyperlipidemia, sugar levels, eye tests, osteoarthritis, malaria, infections, among other ailments, to over 1,500 beneficiaries. For 2 decades now, the President, Dr. Isioma Okobah Foundation, has been tackling pressing medical disparities in one of the world's most vulnerable regions in grassroots tactics.
It's almost 20 years now, and in the course of doing that, I discovered that it wasn't enough, that I would just come once a year, give them medicine, go, and then the 11 months of the year, what happens? So I built a medical center here in memory of my late dad, Stephen Uche Oko Memorial Hospital in Ndobo, where we have a doctor that gives free medical consultation, we have nurses, they take free deliveries and get free medications there too. So in the course of doing this, we continue to do our medical outreaches where we expanded beyond just Igbodo. We do it in the whole of Delta State. And then in doing that, I also got an appointment with the previous governor, Senator Okowa, to be the chairman of the Primary Healthcare Development Agency. So I worked in conjunction with the Delta State Primary Healthcare Agency and scoped around the rural communities in Delta State, every nook and cranny we went to. And I saw that there's still a big gap in the equality of healthcare that the people in the rural communities get. Then going back to America again, after completion of my term, I still decided and had that urge to still come back and do what I started doing way back in 2007. And that's why we're here today on a 2-day medical mission. We actually came from the United States of America for 2 days to give healthcare to the community in Igbodo and the environs. We have people coming all the way from Onichubo, Umunede, and people who can make it here.
The foundation has successfully implemented outcome-oriented strategies to promoting healthy living, combat diseases, and establish meaningful relationships with low-income communities which crave authentic communication.
It's a calling for me that I have to want to help the less privileged. And it's in the Bible that we give on to the less privileged. And that's what Jesus wants us to do. So you don't even have to have too much money. I don't have much money. I'm grateful to God for the blessings He has bestowed on me, but you don't have to have too much money. Like I said, this all started out with coming home on vacation and then just doing a small check of people around you and then helping those group of people, and then it grows from there, and then God starts to bless you more and more. But one thing I want to assure people is the greatest fulfillment you get from doing this, you can't even describe it. When you help people who can pay you back, I mean, you can't even describe the fulfillment you get from it, and then the blessings that follow after that. Well, for patients, we say to them, prevention is better than cure, and health is wealth. You can say, oh, I'm not going to come, I want to go to farm. When that sickness holds you, you can't go to farm. You can't even do anything. You can't even enjoy the food. So health is wealth. Take good care of yourself, and in taking good care of yourself, prevention is better than cure. So make sure you go see. We have the primary healthcare center here. We have the Stephen Oko Memorial Health Center in Ndobo. If you fall sick, just don't sit at home. Go seek medical help. You can see the doctor. If there's no doctor, there are nurses, qualified nurses to see, and then get medical attention. And then if they can't handle it here in the community, because of course, that's why we have referral system. They can be referred to Asaba. And thank God we have the First Delta American Hospital. We continue our charity work through there. It is for profit, but we also do have a section where we do charity through there. Okay, so they still have those options to come, but they must take care of themselves.
The representatives of the WHO coordinator, Dr. David, in his goodwill message, said his organization was pleased to be part of the programs.
Our support for what the Dr. Isioma Foundation is doing for Delta State. WHO supports integration of all health activities, which is what is currently going on here. From what I can see here, there's a routine immunization going on, routine BP checks, vital signs checks, and medical examinations, and other activities, health activities going on. This is what WHO supports, and this is what WHO stands for.
On his part, Dr. Paul Yinkore of the Delta State Primary Healthcare Development Agency, in his remarks, emphasized the need for the collaborations to achieve a common good for Deltans.
We are doing these things together because no single ministry or profession can do it alone. Health means all of us. All of us. We need those in our Greek to give us good food. And that's why here we have planned to make a stand for those doing nutrition program. So if your children are infants, not more than 22 years of age, bring them out. We'll give them vitamin A. And also, I want to also tell us that we're also using the opportunity to provide basic minimum package of care for you.
Little wonder, did the Bible say that whosoever is kind to the poor lends to the Lord, and he will reward them accordingly. Proverbs 19 verse 17.
For what I've seen here, it's really a blessing from God through our sister Isioma Okobah, isn't it? And while I continue to thank God for her life and for the goodness she has shown to her country and to her hometown, I will say the good Lord will continue to bless her, continue to inspire her in her work, and in the end, let God use heaven to pay her for the good work she has done on earth here. And all that joined her to care for the sick, for the disabled, every other means they used to care for us, the human beings. May the good Lord replenish their purse through Christ our Lord.
Simegi atu ye oge ngwagwe ke my eye ere ono simatu ye ogun ngbe no ede meyi we gbanyan nchone ngwan ekwo na oso me ekwo oso ngwan aguma kan kenkele yi mu we gbanyan asa ne meka la aheri me ekwo so gbanyan we ye nwura kangire ela aheri me ekwo ana hwa ne ma agwo huma osolobo ya gozi Dr. Isioma ne okare na mma omeyeke ihu ko kaga ya lezilola ihe owulobu akachi okare na mma ananu emewo nchan yo ofekweye mu egbanyo ofekweye m ogun ya ngire eme na ekpere ni okare na mma okare no mma can for Jesus.
The essence is very fine because I think this is a way of helping the rural communities to improve their health. My prayers for her is that God will continue to bless her. And as God blesses her, let her continue so that she will be helping improving the health of the rural communities.
In Jesus' name. The always what he's doing in the community affects the whole Deltans. That is my interest, and that's why I've come to observe, because what her efforts are worthy of emulation. Most of the things he's doing here, not every doctors, not every woman that has money that have lived abroad has come back home to give free medical services to her people.
No doubt, the president, Dr. Isioma Okobah Foundation, wouldn't have soared this far if not for the support she's been getting from the husband.
A beautiful jewel has no hiding place. My wife is a beautiful jewel, and it would have been a big mistake or disappointment if I fail to acknowledge and support something good. So I supported her because she's a good brand and she deserves and earned the support she received from me. Well, I feel accomplished, I feel happy because I also quietly or silently do exactly that. Only that I don't like my name being mentioned, out, but I do more of helping people behind the scenes. So when she's doing it, it's part of the family's trajectory. This is what we are, known for. This is what we do. Even my kids, they all, into charity. They do a lot of charity, helping people. What we derive is joy in helping the less privileged, those who are less privileged. If helping them is the biggest sacrifice you can make, for human existence. Helping those who are down to stand up, those who are sick to get better, those who cannot afford food to eat. It means a lot when you do it for humanity. You don't do it for money. You don't do it for any beneficial interest, rather for humanity. That's what we need, that compassion, that poignant, a response to people suffering, those who are down. You don't need to keep them down. You need to help them get up.
As it is in the regular hospital, such as the First Delta American Hospital, Asaba, the first point of call was the registration point, the laboratory department. Next was the nursing station. Thereafter, the patient was transferred to the doctors for consultations and prescription of drugs, and the last point of call was the pharmacy.
All in a month to tell my friend is a Mahoma. He was Jacamato Kainama, Ndioche Mahoma, Ndioche Mahoma.
They don't check me, they don't test me, they don't give me medicine, they don't give me ice glass. This is the thing where somebody do. It is very nice. We give Igbodo. It says yesterday, they treat Igbodo. Anybody where they sick, go to West Wing, go to eye, ear, any complaint where you get, they give us medicine. The prayer where they pray, say God to straighten, to give a long life for this generation. Where they, I see they help people with the sick, people who locate, God will help them. The hospital will raise.
The exercise is quite exciting and very good. Very, very good. It's a thing of joy to see some persons that feel and appreciate that God has blessed them, giving back to the society and the less privileged. So, Isioma Okobah Foundation is to be reckoned with. And we are praying that God will continue to uplift that foundation and herself and the family. Because many people are in need of health facilities. To offer it like this, free of charge, you can see that many people are happy. So it's an occasion she has used to put smiles on the faces of people. I've benefited. I heard of it and I came, and I've seen that it is real. So God continue to bless her and the foundation.
Ihe busy da somoso na yere ama agwa anya nkara na anu aneguzo yakobi so all busy somoso nlekene chukwu maka Isioma nwana mo snobo ya buzani menu na afa Jesus.
Oh, my name is Blessing Eduje. I come take a drug for here. No money, not free. My prayer be say it go better for Isioma. Nothing when Isioma go lack like. As Isioma remember us say we dey sick, he bring medicine for us. God go do me, he go better for him. No only sickness and die go run for him. He no go see battle.
It might also interest you to know that Dr. Isioma Okobah did not just meet their medical needs. She also provided quality meals for the beneficiaries for the 2 days the ship of her kindness bettered in Igbodo.
I would say I feel very fulfilled. There's a feeling you get that's so full. It's like, let me use the analogy of a glass of water. And if you have a glass of water and it's full to the brim, that's how I feel right now. I don't feel 1/4, I don't feel halfway, I don't feel 3/4 or even near the brim. I feel full and overflowing with joy. Well, it does take a lot of planning and logistics to really go around Delta State, but luckily we've been able to incorporate 2 more communities into this outreach. So instead of making it a 2-day outreach, we're now going to make it a 4-day outreach. So tomorrow we'll be present at Onuchubo, which is in Ika North, and then Saturday we're going to also go to Ika North, but far out in AZ community, to offer the same services, free medications, free medical consultations, free reading glasses, and just share the joy. The thing is, when we do this kind of work, we also partner with the government because we can do it all by ourselves. We know the Delta State government is actually doing their part, such as with the primary healthcare centers at the rural level. So that's where the partnership comes in. And if you notice, I mentioned the primary healthcare centers every time I talk about the communities accessing healthcare. They have to go to the primary healthcare centers, which is being run by the Delta State government to provide healthcare. So at all times when we come in, we never come in by ourselves. We have to collaborate with the state government, and we walk through the primary healthcare centers because they are the ones situated in the rural communities. And through their programs, like yesterday, you saw the programs, the nutrition program was here, malaria program was here, WHO was also here too. So it's a collaboration, we all work together. It's called teamwork, and teamwork makes the work, better. So that's what we're all here for. We're working together with the state government. And I must say, we still have ongoing health fairs and medical missions, but in smaller capacities through the year. Basically, like once every month, we're in one community doing health medical outreaches like this. So it's not as big as this. We do this big one once a year, but the smaller ones, like every quarter, we go into smaller communities to do the free medical outreaches. Right. It was a huge success, and we're still, and I guess because of the success we have achieved, and we're giving glory to God, because without Him, this would not have been possible. We had great weather, there was no rain, it was just awesome, and then there was God has just been with us, so we give all the glory to God. And then I have a great team, and I just want to say thank you to the team of doctors, the nurses, the pharmacists, the lab scientists, the medical team, because we also have people who even just do the triaging. They make sure, the volunteers who make sure that there's no chaos. It's so orderly. Everybody put in their best. So I just want to say I am grateful. And again, to the eye team, we have the optometrists, the ophthalmologists, all of them are out here giving their time and their talents. So all I want to say is thank you so much for an awesome job, and God in his infinite mercy will grant you all your heart desires. And trust me, the patients have prayed for all of you, and those prayers go to the high heavens. Thank you so much.
No wonder the traditional ruler of Igbodo Kingdom, Obi Barrister Ikechukwu Usedume, described the role Dr. Isioma Okobah has taken in saving lives as matchless and prayed for God's divine uplifting.
Kindness are of different kinds. There are people who give you food. There are people who help you pay your house rent, give you shelter, and a whole lot. But for me, I feel addressing your health issues is a very important aspect of your life, because they say health is wealth. It is who that is healthy that will do what? Look for money or look for food. So I believe this aspect of her addressing the health issues of Igbodo, giving them free medication and attending to their illness and needs, you understand, is a big one for me. We have seen empowerment where they share food and share a whole lot. These are another aspect of empowerment where you get to check people and make sure that they are healthy, give them what it takes to be healthy. So I appreciate her, we all will appreciate her, and I want to point it clear that this is not the first time she's doing this or carrying out this program. She has been doing it as time goes on. She has been coming through. So we want to appreciate and encourage her for her not to let this be the last, because she also knows the impact of what she's doing. She has seen the impact in the lives of Igbodo people. And when you go outside, you see the crowd of people who are there. You understand? Nigeria economy also is not helping. So we say more grace to her, and God keep her and provide for her. Whatever she's using to run this program, God should supply her.
Dr. Isioma Okobah understands that we make a living by what we get, but make a life by what we give. For this reason, she has also reached out to the Onijubo and Ezi communities, both in a national local government area of Delta State.
Delta American Hospital.
I like this movement. Thank you. Thank you. Yes, thank
you.